we'll call the EMS Commission meeting to order at 7:01. And we'll go ahead and do a roll call. I don't know, is Michelle joining us tonight?
She is not. She had some family things come up, so I actually chatted with her today. She's not able to join us tonight, so I'll be doing double duty.
Okay,
so
well, go for it.
Stuff comes up, right? Patrick, write that down so we don't get involved. So yeah, we'll call it 7:01. I'll take the notes and we'll do Strassman.
Here.
Perfect. Roberts, I don't see him. He may be joining late. Hilla did let me know she would not be here. And Lonsdorf.
Here.
Schnapp.
Here.
And Lugenbuehl.
Yep.
Cronin.
Present.
Miller. Not here. And Johnson.
Here.
And I am here. There's Roberts.
Yep, we have a quorum.
Okay.
I believe, right? 6?
Yes. Yep. And JR has just joined us, so we're up to 7. So we're good.
Okay, good. Did we get any public comment requests?
I have none.
Okay, well, let's just go ahead then with review and approval of the minutes from November 18th. Are there any comments, corrections? Hearing none. All those in favor of approving the minutes as submitted for the November 18th, 2021, signify by saying aye.
Was there a second? Was there a first and a second?
Pardon?
I'll move to approve them. Lonsdorf.
Okay.
Oh, yes. Okay, a second.
I'll second.
Okay.
All in favor, signify by saying aye.
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 Aye. Anyone opposed? Hearing none, the minutes are approved. Patrick, you want to go into the chief's report?
Sure. So I believe it's up on the screen there for you to see. Is that correct?
Yep.
Okay. And so I sent this out to you so you can see where we ended the year at 4184 for our calls. So that is just over 20% where we were last year, which was about 2% over the previous year. So like I said, as we saw that trend happening over the course of the year, that kind of remains to be seen. What will happen with this year? We're on track. I think as of yesterday, I looked for about 310 for the month, which would be less than year, but more than last year, but less than the year before. So still kind of right in that peak there. We are starting to see a little bit more probably suspect COVID patients with those respiratory and cold symptoms. But that's where we ended the year at. Otherwise, the rest of the numbers look they're a little bit busier in Fitchburg than everywhere else. Our median times are good, so ended our year at just under 12 calls a day. You can see what our training is there. Community events have kind of calmed down a little bit. We have started doing a couple of, I've gotten reached out, a couple of community groups have reached out. We've started doing some more CPR classes. So just the smaller groups with some good distancing and taking those precautions, but have started to do that. We are kind of back at the Alliant Energy Center, which is waffling back and forth of a couple more events that have been canceled there as well. But so slowly getting back out into the community.
Hey, Patrick.
Yeah.
On the education on the trafficking, who did that education?
So that was one of the nurses from UW,
Okay.
Health.
Do you know, do you have a PowerPoint or anything? That's something I really want to work on with our staff this year.
I can get you the contact information, and then I know there is actually a last year when we did it, because it's part of our refresher requirements every 2 years to do something on human trafficking. There's actually a whole web. The federal government puts it together. There's actually a phenomenal
but if it was
site.
If it was already put together, I was going to steal shamelessly.
I will get you that contact information.
Thank you.
Yep. You just see the rest of the statistics that we have there. Nothing really abnormal. As usual, Fitchburg Middle Station does most of our runs. As far as the end of the year stuff, sitting right at aging report, all of those numbers are right where we expected to be. Probably after the first of the year, Three Rivers usually kind of goes and does a push and does a kind of a solid clean of anything over 90 days on a status report of those either get cleaned off and sent to collections or we get an update on where they're at. So this is the unofficial where we ended our year. I shouldn't say unofficial. That's what was in our checking account and our money market at the end of the year. We still have those kind of trickle over bills that come then. We still have like the medications we purchased in December, the fuel costs for December. So those things are still coming out of that 2021 budget item. And we'll pull up the in-house operating budget here, but that's where we ended the year at. We didn't go broke, so that's a good thing. So nothing alarming there. Kind of right just about where we were at the end of last year. Nothing new. We did get our FAP funds for the state. The state fiscal year is July 1 through June 30. So that always throws a little things off with us. But we did get our funding assistance program, about another $8,000. Roughly half of that we can use towards equipment aids and improvement. The other half of that goes into a training pot. So the 5,000 that's actually sitting there is sitting there for a training pot. Again, there's kind of I've shared before. There are restrictions on what we can spend that money on. So you don't see the funds reflected there because we just got them here a little bit ago. And then just a reminder, the WISC stuff there, those are now in CDs, not money markets anymore. So we aren't going to see the interest on those until those mature. As far as milestones, we got a couple of them in January. So January 3rd was my 21st year at Fitch-Rona.
Congratulations.
So,
Yeah, that's crazy. We'll have 2 more employees who will also hit their 21st year here this year. We all started that year. 21 years ago is when we became a paramedic service. So there's 2 other employees who we all 3 of us started at the same time. So we'll hit that mark. It's pretty impressive. I mean, most organizations. And then we have David and Kyle who are at 17 years. And then Molly is a third one she was a part-timer before then, but came with those 3 of them were hired at the same time. So she became a full-timer at the same time. So those 3 full-time will hit 17 years this year. So the usual kind of information, we have some significant longevity here at Fitch-Rona. So hopefully doing something right. And then I reached out to kind of our other comparables. When we get, Dane County does an annual report with about 3/4 of the services in Dane County participate that get end of the year run numbers. I predominantly compare us to Middleton and Sun Prairie. They're the other 2 paramedics services that are close in size to us. But you'll see Middleton crossed over that 2,000 call volume for the first time this year. So they were up 18%. And then Sun Prairie hit 33. So he was just at 5%. My understanding is everybody in the county has been somewhere in there, but comparable. So it's happening everywhere else, that big call number. Any questions on that?
is Patrick, is the thought that the rise in number of calls is principally COVID and it will get better when COVID goes away, if it ever does, or is it thought that there's some other reason? Or not?
We're not sure. It started off the year being COVID calls, and that quickly went down kind of once I want to say vaccination was the cause, but it went down after the big spike in November, December. It kind of went back. We were still getting those calls, and then in June, the 911 center stopped tracking, and I want to call it, they weren't identified as COVID calls. They're identified as EIDS, the emerging infectious disease. I don't remember what the S stands for, but so the 911 center stopped tracking it. But throughout discussions, we're not really relating it to COVID. It's truly just volume. But it's unproportional to the growth of any of our municipalities. So I have no idea because it's still all over the. It's as I reported every month, it falls and although sick person will tend to come in, I have the cold,
Just a
general, like,
second. Yeah,
yeah, cold and flu-like symptoms, which we now know it tends to be this new variant of COVID. That's how those will come in. I think the uptick in the last probably 2 months here for us has probably been that, but I don't think it's really COVID related. We'll see.
All right, wow, that's amazing.
The other note I have at the bottom here, and I think this is probably just the place to throw it in because it's not anything we're going to discuss or have a motion on, is this year is a contract negotiation year. And I'll just throw it in the chief's report here. So the current collective bargaining agreement is up at the end of this year. So we'll have a new contract starting at the beginning of next year. I'm just throwing it out there as far as the municipalities to put in some food for thought on who and how you would like that represented. Historically, it's been the seating member of each one of the communities to be part of the negotiation committee. And then I think JR, you hopped on there last year 4 years ago now as well. So we had 4 people on there. I don't want to, I have a seat at that table just as kind of the operational perspective when you have questions for me. But it's you can have as many or as few as you want. I did get Adam from the city administrator for Verona and Chad Brooklyn, the city administrator from Fitchburg. I don't want to say have expressed interest, but it sounds like I have maybe expressed interest or willingness to also sit on that negotiation committee. So I'm throwing it out there. Again, it's not on here as a discussion item tonight. Probably March, April timeframe, we need to commit to putting that committee together and get the intent to negotiate back and forth between us and 311. So we can kind of get that done. It's nice to have it done by the rough lease contract or some idea by June or July, so that when August rolls around, I actually know what that budget number is going to look like, because otherwise it's a kind of a best guess thing. So any questions that can occur without discussion on that, I guess?
Patrick, I was to say that we probably need to wait until after the April election to see who is continuing.
Got it.
That's April 5th.
Okay, thank you.
How many meetings are often involved, or how often are they? Like weekly, monthly, 1 or 2, 5 or 6?
I would always like to say I don't anticipate this being very contentious.
Right.
The last one was not. JR, I don't know if you remember, probably 4, I think, we met as our group. We met with them, exchanged information. We met with our group again. We met with them a third time. And then I think we met as a commission. So I truly only think it was 4 times. There was a kind of some permissions given for between Kyle and Greg were the representatives last time. So the 2 of us kind of were able to talk some stuff through before we're bringing it back to our mutual groups. So it didn't always have to occur. So 4 or 5.
Okay.
And then like once or twice a month. It wasn't a huge commitment, but again, I don't believe it was very contentious. It wasn't contentious.
That's true.
One never knows. So yeah, JR was there putting his fist down. So we're gonna pass this. So yeah, David, if you want to be part of that, if you want to turf that too, the city administrators just brought the perspective of because we did a 4-year contract last time and everybody else only did 3-year contracts. We are now after everybody else. So the fire and police contracts for both municipalities were done this year, and they'll bring that perspective to the table. Otherwise, you kind of contacting back and forth between them, so they have bigger picture stuff.
Yeah.
So just throwing it out there. Don't want to, no more discussion other than give some thought for that April. So we can probably put it on our April agenda to pick that commission or subcommittee, I guess. So here's the in-house budget I sent to you. Again, this is kind of a status of QuickBooks as of December 31st, but some of that stuff changes as far as additional bills that will come out of 2021 haven't been paid yet. They'll have been paid this month, as well as the health insurance bills that we pay in December that actually go into effect in January. So some of the stuff crosses over years. So this is kind of just a best good snapshot of where we're at. End of the year, true dollars in with our run income, about 92%, about 143,000 less than was budgeted. But going back to the overestimating what we would have received issue, that's actually much better just because our volume was 400 calls higher than I had actually anticipated anyway. So we were still under what was budgeted, but significantly less than what it would have been.
Patrick, what's the external vendor income?
Oh, we put that in there probably 2 or 3 years ago when we, so like when the fire department buys an AED or like we'll help get gloves for the Fitch-Rona fire.
Okay.
So that's what it is. And you'll see the same thing down as external vendor expenses, because otherwise it throws the numbers off. Especially when we talk about medical supplies that I'm always over any year anyway. So we start buying gloves for other entities out there, or AED pads, Narcan for the police department. That comes, we pull that into its own separate line item so that it doesn't skew our own internal purchases. So that's it. It's a pass through is what it is.
Well, actually, looks like we come out a little ahead, but is that just because of the cash flow?
Yeah, because it's not always catching up from month to month.
Okay, thanks.
Yeah, it's truly a pass through. We don't make money on any of that. We charge them what we pay, but it never matches up. Otherwise, obviously 100% through the year, through the end of December. So for all the other line items, with our salary line items, pretty spot on. Pretty good. We have a phenomenal LTE group that's been able to pick up some hours for us. So as far as our wages went, we came in under budget, a little bit over in retirement. We had one more LTE cross into state retirement by putting in more hours this last year. So that's actually something I actually talked about with Michelle this year about how to kind of adjust that. I have probably another LTE who he's only been with us a couple of months, but has already put in enough hours in 3 months that he'll probably end up in retirement as well. So that's why that one went over a little bit. Same thing with the weird thing with health and dental and crossing over the years. Otherwise, those kind of payroll expenses were within budget. As we've shared every other month since we started doing the budget, fuel, oil, repair, and gas reparts, we had some really significant mechanical issues happen this year. With some suspensions and fuel lines, and so in addition to just the rising parts that unanticipated, we had some tire issues. It just went high. So next year we did those were the 2 line items that significantly increased. Other stuff you'll see there that we went a little bit over is the personnel recruitment. Just because we recruited some EMTs for the Alliant Energy Center. Facility furnishings is where I tend to kind of tap into and safety supplies is where I kind of put a lot of the COVID stuff. So we have to get foggers and sprayers and cleaning equipment. I'll put that in there. The medical equipment one that's way over, some of the weird one-offs, the grant purchases. So when we get like the ventilators, so they'll come out of there, but truly those were reimbursed by Epic, but there's no way to really show that right, because it comes out as an expense. You can look in there, if anything jumps out at you, most of these, they were anticipated over. We've been talking about them all year long. Really, to me, the one to look at is that bottom line there of that total expenses came at 99.4%. So what was anticipated to be budgeted, we spent 99.4% of it. Again, there's a handful of bills that have not come in yet, but there's about a $70,000 window in the $3.2 million budget. So we should be pretty spot on. So excellent. This year
Good
is,
job.
thank you. This is our big audit year. And so not next week, February 2nd, I think. Michelle is working, we'll have Natalie from Johnson Block again. She worked with us last year. She'll come in this year and do the big audit stuff that they do every year. So that'll happen in a couple of weeks. And then by the end of March, we'll have that official number for you. So doing okay financially wise. Any questions?
Okay, thank you, Patrick.
Do you expect any of the increased costs for medical supplies to go down, or you planning on increasing things based on the increase of supplies over the last year and a half?
Yeah, so I can't remember off the top of my head, the 2022 budget, I increased it by almost $25,000. Let me pull this one up. So we spent, what did we spend? 126,000 in medical. Oh, that was the forecast. We actually spent $77,000. No, that was the budgeted. 126. We spent $126,000 in medical supplies last year. I upped that to 100,000, and I think it was only at 77 the year before. It just keeps going up. I don't anticipate it ever going down. Same thing with medications. We've got 2 new medications shortlisted that we're switching over from prefills to vials. It takes a little bit more time, but it's something we can get access to. I think the long answer to your short question is no. It's just going to keep going up.
Trust you're adjusting the budget based on that.
Yeah. Yep. So that was why we saw our first pretty significant increase in 2022. It's probably going to go up again. Same thing with the cost. I was just talking to the ambulance provider. Again, I mentioned earlier the Saria, who's our Braun rep, looking at the 2023 purchase of the ambulance already, since they're talking 16 to 18 month builds. So just trying to get something. I know I officially can't purchase it, not being until next year, but if we want to see an ambulance in 2 years from now, I kind of have to do a handshake agreement of shopping and building one for 2 years from now. But she already gave me the heads up today that the prices that they're seeing, from door handles to hinges and everything, is skyrocketing, to include auto manufacturers and just buying vehicles. So I'm planning 2 years out and shopping ahead already on that as well. So we should have enough time to start adjusting at least our 2023 budget. Any other questions?
Okay, let's move on. Personnel finance did not meet, so we'll go on to review and approval of accounts payable checks. Everybody get a chance to look at them. Any questions?
I think there was one in there around December 15th. I think it looked like Dane County Treasurers, and it kind of listed medical supplies.
Yep, that has to deal with us buying medications now through the vending machines. So so those are our medications. So you'll see, it used to be that much we would pay to Meritor. Now we have a very small amount we pay to Meritor, and we pay Dane County because Dane County buys them bulk, and we get them from the vending machines.
Okay.
I still track our expiration dates. I think it's going to take a couple of years to truly see a huge savings in that. Epic graciously has paid for at least the first. It's a subscription to keep those machines running. It's a cloud-based system, so it's always sending reports to people to fill them up. Our crews go in, thumbprint with some information in there, and that's how it tracks and vends medications to us. And then at the end of the month, we get that report eventually we will we're between the paramedic services and advanced EMT and EMT services. There'll be a pay to play kind of a program. But as of this moment in time, when we kind of first set this up, we, even as a paramedic agency, will probably only be paying about $800 a year. I'm keeping track of what we're throwing away in expired medications because I don't have to keep them on hand anymore. I believe is going to outweigh the $800 that we end up paying, which again, we're not even paying this first year because Epic has sponsored that. So I'm going to continue to keep an eye on that and make sure that there's a financial advantage for us to do that. But it's been a great cooperative effort between Dane County for them to do that.
Any other questions? If not, motion to approve the accounts payable checks as submitted.
Make a motion to, as submitted.
Thank you, Susan. A second?
Sponsor.
Okay, Dave? All in favor of approving the accounts payable checks as submitted, signify by saying aye.
Aye.
Anybody opposed? Hearing none, the accounts payable checks as submitted by Chief Anderson are approved. Move on to review and a possible action of the GASB 54 revisions.
So I did not do a GASB this month because when the auditors come in 2 months, we'll get brand new prepaids and supply
Okay.
amounts.
We'll move on to the 3 policies, I guess you wanted to discuss and possibly approve.
Sure. So thank you. So there's 3 of them there. I don't think there's a lot of discussion in here, but I guess I'll look and see what your input is. So policy under recruitment and retention of employees. So this is for all new employees. The only change I made to this is a policy that's been previously approved. Have had some discussions, and we'll probably have another one next week is our next EMS Association meeting about what other services are doing as far as the potential to require the COVID vaccine for employees. I, again, mostly compared to Middleton and Sun Prairie because they are my comparables. The difference between us and Middleton and Sun Prairie is that we are exactly opposite of Middleton and Sun Prairie, where the EMS here is a district and our fire services are city owned, whereas in Sun Prairie, both in Sun Prairie and Middleton own EMS and their fire districts are districts and have their own boards. So at least in Middleton and Sun Prairie, they're most likely going to tag on to whatever the state, it's a city group, right? So they will do what the city wants. And at least at this point, my understanding from is they have no intentions of requiring the COVID vaccination for their employees. I have no intentions and no desire to work backwards and require it of all current employees. It's just a can I don't want to open. But I truly believe that I would like to require it of all future hires. I know I brought up we're all facing some challenges with the recruitment of LTEs. I think if I did a job posting for a couple of full-time positions today, I would have zero problem filling it, even with a COVID requirement. Maybe a little bit of LTE, but I don't think this is going to be a problem for us, and I would really like to see it in our policy that it is required. Guess I'm putting out there for discussion if you think I'm off my rocker or should not do this.
No, I think it's a good idea.
Yeah, I do too.
I agree.
Yeah, Patrick, we just finished going through a round of hiring for a position at UW. And even though at UW it is required, we had candidates who asked, am I going to be coming into an environment where people are vaccinated? So I'm all for it.
I'm opposed to it. I think it ought to be personal choice whether they get the COVID-19 vaccine.
Okay.
And I respect your opinion. It's kind of different in this servant position on on taking care of other people and putting other people's lives at risk.
Wouldn't it be the same for flu too? Like, could we put the flu one in there too?
I have
When you
not. put
think
the
about
flu-
that?
Yeah, I have not made that one mandatory in the past. We've done a little bit of research when we kind of even put this policy together to begin with, and that's why it's separated out with the dots. It's truly the only one I can. The state of Wisconsin requires everyone to have a measles vaccination. It does not require any other vaccination on there. And that's actually why it is labeled the way it's on here the way it is. The rest of them are to me are just truly things that we interact with people who are immunocompromised, and for us to that's I'm viewing it as for us to have that and potentially pick up somebody who we will pass it on to them because we didn't get vaccinated. And so that's the approach I'm taking, but and that's why I'm asking you.
Yeah, I think it should be in there. I think there's a consensus, I guess. If not, we can take a vote.
And the staff does get reminding you how the policies work. So you'll vote to approve or not approve. Here, the staff gets a 21-day input. If there's any concerns or comments that are brought based on these, will bring them back to you to review, and then you can relook at it again next month if with the concerns of staff. But did you want to do a roll call? I'm guessing we should probably do a roll call vote on this.
Yeah.
Does that work? So Strassman.
Aye.
So yeah, so we're voting to approve the policy as did. Okay. Robert.
No.
Lonsdorf.
Aye.
Schnapp.
Yes.
Lugenbuehl.
Yes.
Cronin.
Aye.
And Johnson.
Aye.
So the yeses have it. So I will present this to our staff for their input, and if there's any significant stuff, I'll bring it back next month.
Okay, thank you.
So the next one is the ride-along policy. There was a lot of, I know it does not flow super well. I took a policy that was 12 years old and tried to adapt it to something differently. So I'll correct the formatting as it is in there, because the ride-along policy was only intended for somebody who said, hey, I want to be an EMT, can I come ride along? I made it a little bit more robust, probably could change the name of it as well to include, we didn't really have anything that covered. So we have medical students from I think they're third-year med students come do ride-alongs with us. We have an EMS fellow, Dr. Catherine Dar, who comes and rides with us, but she's not actually an employee. I always encourage members of our municipalities to ride with us. So what I did was, and students. So they're all ride-alongs. They're not employees, but they do ride with us. So I tried to make it a little bit more robust to encompass all of them. And so that changed quite a bit of other stuff here. So really just addressing who does ride-alongs. It's not just anybody. They have to put in a request. We have to approve them, put in some hours and some guidelines. They don't ride any more than 24 hours. And students, we have a whole student handbook. It doesn't have to be a policy, but it kind of provides some more guidance from students, but puts in some guidelines for them. This all started as well of a year plus ago when Madison College reached out and said, will you take students who have not had the COVID vaccination? So I'm taking the same approach as I did from all potential new hires and said I would prefer not to see any students who don't have the COVID vaccination for the same reasons I mentioned before. Other stuff that's, go ahead.
Does this go through your liability insurance? Do they get covered?
Nope. Students, MATC students are covered as students from the technical college. Same thing with the medical students, as they're students from the medical school. We have a waiver of liability, which, you know, however far that's going to get us from somebody who comes off the street and says, I just want to ride for 12 hours and maybe be a medic someday. They signed that waiver. I pulled it up. I think it's actually part of here. I was actually going to send that to Leslie later this year and say, you know what?
If they're not a minor, right?
If they're not a minor, correct. And traditionally I've only allowed people over the age of 18 to ride. I think I did put in here the age of 17 with
Written permission. Yep.
Yep. As we're trying to, you know, as we continue to look at kind of our internship and reduce diversity and inclusion in our group, you know, I'd really, once COVID goes away, would really like to reach out to our high school organizations and get kind of more introduction to younger people and get them in the program. So I did edit this to do 17 with a parent's permission, but then it would be a parent signing that waiver of liability, which I'd like to get reviewed again. Beyond that, all the rest of this it's truly just stuff of, you know, defining that they can't do anything. It's stuff we've already done. I just made it more robust, following directions of a crew. You might get pushed aside. You might have to find your own way home, where we may not let you in a house if we don't deem it appropriate. So the big thing would be allowing 17-year-olds to ride with permission. The other big change is requiring COVID for students.
I think it's an overreach to require all those documentations of vaccinations for a ride along.
Historically, we've only required a TB test.
I mean, do the hospitals and clinics require all their employees to have all of those vaccines?
Yes.
We require it of our employees.
I understand our employees, but you know, I think for someone doing a ride along that's less than 24 hours or 48 hours, I think it's an overreach. They're not providing care. It's more of an observation thing.
Do they have contact with the patients?
So they can't provide patient care, but they will absolutely be in the back of the ambulance with the patient. They will be in the house.
They may go in the house also?
Yep.
And do they have the kind of equipment that we have as far as?
They're ride-alongs. We actually have not allowed members of the public to ride along since COVID first came out. These days we would give them a mask. I don't know
which may or may not help depending how they wear it and if it fits and everything else.
Yeah. I mean, we're going to require them to put an N95 on, and we're not going to keep them close, but they are in the back of an ambulance with a patient. And again, I just lean towards, we deal with patients who are immunocompromised. And you know, the one time we put somebody with mumps in the back of there to a cancer patient because they don't have a mumps. Obtaining documentation, 99% of these students go in the Wisconsin immunization record, and all of these things are on there.
Yeah. I think it's a liability issue if we don't require that and something happens.
And I actually did remove the TB skin test because there's so much, we don't require that of our own employees anymore because there's just so much documentation that says you're going to be symptomatic way before your test ever tests positive. So that was even the only thing nobody has that unless you work in healthcare. So that was something they did have to go get on their own. I took that off of there. So truly 99% of the people who are going to ride along are going to have this vaccination record all in one place. I'm looking at the COVID vaccination and those are, again, I'm bringing it to you to kind of either tell me I'm off my rocker or you don't think it should be the case.
Well, I was thinking I would like to ride along with the ambulance sometime, and I don't know that I would have documentation of a lot of this stuff. I mean, because I had measles.
My chart, Dr. Lonsdorf.
Huh?
My chart.
Well,
all in there.
Maybe it's there, but you know, I had measles, mumps, and rubella as a child. I never got vaccinated for any of them. And the other vaccinations like hepatitis B, I got so long ago, and I didn't live in Wisconsin when I got them. So, I mean, it's probably somewhere, since I was working as a physician, I'm sure I had to provide documentation, but I don't know how I would find it at this point.
And I don't know how far back Weirs goes.
Yeah. So I'll skip it. I'll just imagine what it's like.
And we don't have to require it. Again, the previous thing, the only thing we required was the hepatitis B. So, and I can truly put all immunization requirements not even on there. I guess I'm just looking out for, I also don't want to pick up somebody with measles, mumps, rubella and give it to somebody because they happen to be in the back of the ambulance doing a ride along.
Hmm.
Patrick, to confirm, I think something you said earlier, that the way the policy reads now is consistent with what you require of your employees?
No, because it's redlined out. So the only thing we required, the way the current policy reads, is a TB test and hepatitis B.
Okay, got it.
Yeah, I'm thinking polio. I had a polio vaccination about 60 years ago,
Okay.
which I'm sure wouldn't be.
And to JR's point, or whoever mentioned it, we will provide them with a mask, providing they're wearing a mask and we're doing what we should be doing. That transmission risk is very low. And maybe I can update the liability that says your personal choices. If you ride along here and you catch measles and die, right? I told you probably should have got your measles vaccination and not ridden today, but you know how well that's going to stand out. So,
Or pertussis, because that's really going around.
yes, and
coming
take it home
back.
to your kid. Is any other discussion or?
Well, your audience for the ride-alongs is basically students, younger people, I guess, not so much community members like my age. So, and you're saying for them, it's pretty easy for them to get all this documentation.
Yes.
Right.
I'm going to not even say younger because I am going to consider myself in that little younger group.
Yeah.
Right there. I know all of, of course, the military gave me twice as many of these vaccinations, right? And probably have an arm growing out of my back or something like that. But in my late 40s, all of those vaccinations are in one place. But I also did it either through the military or the state of Wisconsin.
So would most students have all those vaccinations then?
Yes. Because they're, in addition to us, they're also going to clinical sites. So they're going into the ERs. Do you know, Sue, what you require of your students? Any idea?
The same as what we do for the hospital, which is COVID for sure, hepatitis B. We have to do all the other ones. I would guess that the students do as well.
So at least for the EMS students that we have, the school cannot require vaccinations because it is a school. So it was very, very dependent on the clinical sites to say, this is what I require of students before they can come here. As I meant, there's more, at least Middleton and Sun Prairie, and I'm not for sure there, but they are not going to require the COVID vaccination for their students, is my understanding is at this point. So we're not going to limit, we're not going to put a halt to all students' abilities to become an EMS provider. Because I'm encouraging it for the reasons I've stated before.
But if they want to become an EMS provider, they're going to have to get it anyway.
Not, or find somewhere that doesn't require it.
In Verona.
If they want to come work at Fitch-Rona during the reign of Patrick, I would say yes.
Aren't there some medical places and hospitals where some of the employees are claiming religious exemption.
That does open up a whole can. That's why that's another one of the reasons for me to put it, if I put it in a policy now to require it for new hires, we can do that. Without, I can require it to go back retroactively to many of my current employees. And if there's somebody who claims that, now we have to go through that process. But I can make it a condition of employment without question.
There's the person's choice if they want to work here then or not.
Yes.
Well, I think with this, we're talking about ride-alongs though. So for people who are in clinical fields or medical fields, this stuff should all be required because they're going to be working with patients constantly. But if your audience is also members of the community and sort of anyone else who just wants to see how the ambulance works, this is going to be pretty burdensome for, like, again, people my age or people, older that don't have all their documentation together. It's going to be a pretty high barrier to them.
Okay.
Not just the COVID shot, but getting documentation of all this other stuff,
Well, and I'm just asking too, like, now, if you do require all these things and you say you have somebody who actually has a religious background where they can't have some kind of inoculation or whatever, I mean, can you not hire them because of that? Or have them, like, I can see where you have probably for the ride-alongs, it would be just kind of blanketed, but for like hires, are you able to do that? Would there be like legal issues there? I'm just asking.
So I ran this, going back to the one we just approved, it does say a waiver of these vaccines may be considered based on documented medical conditions. I did not include religious exception to that. I did reach out to Leslie, our labor attorney, kind of along this whole COVID path about what can we and cannot do. It is her interpretation as of this point of this at this point. I can make that a requirement regardless of religious belief or not. If it is a condition of employment to work here, then you choose not to work here. That we have the legal ability for new hires to do that. And I guess that's why I personally am reaching out to you to allow me to do that for new hires. Ride-alongs, I don't have it in there because I guess I always feel that a ride-along is a courtesy. That's not my primary job, right? My job is to protect my staff and the public. And I don't want to give somebody measles and mumps or rubella, whether you're my patient or you got it on a ride-along.
Well, what happens if the person who has it may have the mumps or the measles or whatever and gives it to somebody else? That would be more my concern. Because if you can't get it, if you don't have the vaccination, I mean, you've been taking a risk your whole life.
Sure.
You know what I mean?
Yep.
I'm just saying, like, it's not a cut and easy choice, but
it's not.
I would just say I just wouldn't want somebody else, if you're going to require it for people to be in an ambulance or new hires, then the people that are riding in the back of the ambulance should have it for the very same reason.
The majority of the legal decisions recently have not supported religious exemptions. They have supported medical exemptions, but not religious exemptions. And I agree that it's about protecting the patients that you're transporting, but it's about protecting the people who are doing the ride-alongs as well. So I don't have a problem with that policy.
Is there any more discussion, or do you want to put it to a vote on moving forward or taking it back? Either way.
Comfortable with putting it to a vote? Do we want to do a roll call vote again?
Yep.
So I'll move, we approve this policy.
Okay.
Second?
I'll second.
Okay, then we'll do so as Patrick calls, I guess we'll say if you're yes or no, if you're in favor.
Yeah, so Strassman,
Yes.
Roberts,
No,
Lonsdorf,
Yes.
Schnapp,
Yes,
Luginbuehl,
Yes,
Cronin,
Yes.
and Johnson.
Yes.
Okay, so the ayes have it, just like the other one. This will go through a 21-day input period. My guess is some staff may have. I mean, it's a ride-along policy, but if the staff has some significant input on it, I will bring it back to the commission next month for you to review their input. To review their input. It's not really clear that you have to vote on it again. I put it back on here for discussion and review, and then we can always open it back up.
okay, so it's approved tentatively, conditioned
In 20
on with the
Yep.
feedback is from the union. Okay.
Yep. In 21 days, it becomes effective based on staff input, or we'll come back to you to share that staff input.
Okay, sounds good.
The last
And,
one the last one I have is pretty cut and dry. There's going to be a ton of discussion on this one. You actually saw this one 6 months ago. We had an employee who we haven't had one in a while who is pregnant. So we had put together a maternity duty and leave. Has since come back to work, and now we did this essentially are addressing the lactation part of the policy. We reached out to Sarah up in the city of Fitchburg HR, we have 2 other female employees who worked here while they were pregnant and came back after pregnancy to see what has been done previously, and did our best to become compliant and match what had been done. It's been, I think the oldest, probably 13 plus years is the oldest one now that we've had to deal with this. So didn't have a policy in place. So went through with all of those consults and updated the policy that you approved about 6 months ago to really just include lactation stuff while on duty. It's a little bit of a challenge because of the nature of what we do. We do our best. The person who is affected by this isn't always at the station that Jeff and I are at. So to cover for that, somewhere between half an hour to an hour, whatever is required for her to take care of what she needs to do. She is being provided the area to do that. We have refrigerators. She has access to, so all the stuff that's in the Fair Labor Standards that deal with this. The biggest challenge has been essentially they do have to go out of service for about half an hour to an hour, about every 4 to 6 hours, depending on the nature of call and what she needs to be doing. So I don't want to say it's been a bit of a challenge. We've been able to absorb it, but it is occurring. And for however long she does continue to desire that she wants to do breastfeeding. So I guess making you aware of it, all of this is compliant. We don't really have a better way to do it. If I could hire a third person, I'd be hiring somebody for an hour every 4 hours, which doesn't really work.
Hey, Patrick, do you know if anybody talked about, there's an apparatus out there where she can put a machine on, and our PAs and some of our people in OR have a machine that they can work while they're pumping. I mean, we invested in the cost, but I mean, that might be worth looking into, or if she's even willing to use it. But I mean, I can get that information if you want on it. I'm fine with this policy, but there are things out there that they can use to work and pump at the same time.
Sure, I can ask for if she's interested. I think probably one of my thoughts is just the nature of what we do is so unexpected. The physical requirements that are potentially there to try to even mess with putting her in that position to have to carry somebody down a flight of stairs or do CPR.
Mhm.
I'd rather
It's-
just,
It's pretty, it's pretty
okay.
intriguing and compact and
If you want to send it to me, I will absolutely share it with her.
sure.
Otherwise, is there any other questions or discussion? She contacts the 911 center, she contacts the other crews to let them know that that's the case so that they are more aware of why they're going into other districts should the need arise.
So you've been pretty much operating under this procedure for the last month or so,
Oh, 2 weeks.
2 weeks?
And I can't say that we've missed any calls because of it, but it's not to say that we won't.
Well, it's always a little bit hard to accommodate pregnancies and breastfeeding and stuff for everybody else, but I applaud you guys that you're trying to work with it and do it. I think it's a real important issue. Just basically to be sensitive to people's family needs at work, because it's important for people to be able to raise their families as well as, be a good worker and stuff. So,
Sure. Thank you.
So any other discussion? Otherwise, you want us to go ahead and approve it then?
That'd be great.
Yeah.
Okay, there's a motion to approve.
I'll make the motion to approve this policy too.
I'll
Okay, thank you,
second.
Dave. A second?
I'll second.
Okay, thanks, James. All in favor, signify by saying aye.
Aye.
I
Anyone
Aye.
opposed? Hearing none, the policy for maternity duty leave as submitted is approved. Thanks for taking leadership on that too, Patrick. It's an important area.
Jeff did a lot of the footwork, so I'll throw him his
Pass
credit.
it on, yep.
Yeah.
Okay, well, the MOU,
So I'll bring this up here for another discussion item. So this originally it came back at the request from staff had asked for this for the last couple of weeks. So this it's exactly the same MOU that we had under the federal directive for the Families First Coronavirus Response Act. Again, back in 2020, 18 months ago-ish. That provided that additional sick leave to employees. If you remember right, it actually exempted first responders from it, but understanding that they were, I want to call them frontline workers, but we're exposed to that. We don't have the option to work from home. We're out there picking up people with known COVID. So that historically was provided to them. We gave them 96 hours because back then the quarantine time was 2 weeks. So 96 hours covered those 2 weeks. And that was March of 2020. We extended it all the way through the end of 2020 and actually extended it 3 or 4 more times through June of 2021 was the same coverage. So it's exactly the same policy exactly the same MOU that we proposed to 311 before. With the new spike in here, and that as you have seen from the news and we got from Public Health today, the contagiousness of it is just exponentially higher. I can tell you, even as of today, we've had, without sharing personnel issue, we've had some employees test positive. We've had some employees' families test positive, more than we ever had 18 months ago. So they have sick time, but because of the nature of what we do, again, they don't have the option to work from home. One of the proposals is to make it retroactive to January 1st, is to provide them 48 hours, right? Instead of the 96 of 48 hours of essentially additional sick time to be used for COVID-related absences. The requirements are the exact same ones we required of them 18 months ago, that they are subject to being quarantined, right? So they have a family member, they meet the CDC guidelines, which we have approved through Dr. Cronenfeld, who's the county medical director. So works with Public Health, Madison Public Health, to put forth some guidelines for us on quarantine. So, whatever that significant exposure is, So they're subject to public health says you should probably stay home for the next 5 to 7 days. They've been told by their physician they need to quarantine. They have symptoms, right? So cough, cold, flu-like symptoms, fever, and they are seeking a test. If you've been following the testing before 4 or 5 weeks ago, if I went in to get a COVID test, I would have it back the next day. We are now looking at 2 to 3 days before we get results back. And those are on the quick, short of not the rapid tests, but the nasal swab test. That what we got from public health this morning is that, given some different places in there, but the fastest people are getting things back are about 40 hours. So even if you have a cough and cold, you're not going to see those results for 2 more days. And then the last one is they're caring for a family member. We got 2 people whose kids were sent home from school and not allowed to come back for 5 to 7 days, and they're presenting with some childcare issues. So same guidelines we provided them 18 months ago. As well, they have to ask for it. I mean, I'm calling in because of one of those reasons. They have to be taken in 12-hour increments just because it's management of those hours. It's kind of can be a challenge. They do have to provide that they were told that, right? So we do need the results of a positive or negative that they actually went and got a test. So yep, they can say I have a cough and go take a test. They just have to provide the documentation that they got the test and that it was positive or negative. The pay, right? This is just the pay stuff. It follows their normal sick time pay. The sick leave does not carry over. So whatever the termination, I put it on here through June 30th. According to public health today, the hope, fingers crossed, is that we are at the peak. That it's been plateauing out. But this
I
still
sure
gets
hope
us,
so.
right?
Oh my God.
This gets us 5 more months, right? Gets us through the end of June. This is through. We can shorten. You can propose to shorten that. We can always extend it. Should the need be. It is retroactive to January 1st, kind of when we first started seeing this. And the other thing that's on there is just like we did 18 months ago, the hours are not replenished. So the original proposal was 96 hours. That was extended, what we said 3 or 4 more times. People didn't get more hours. So I do have 2 employees who used the entire 96 hours a year and a half ago. You don't get more hours. So their banks were built with 96 hours on March of 2020 or whatever that date was. In June of last year, I essentially shut it off. What I do is I go back and turn it back on. So if you had 0 hours in there at June 30th of last year, you get 0 hours. If you have 48 hours, you get your 48 hours. Or 72 hours, it's reduced to 72. So again, it's not replenished. It was so it's an equal, that equal opportunity being that everybody was given the same bank. You're just getting it again. It's an MOU. So you can give them more hours, you can give them less hours, you don't have to give them any hours. You can change the dates around for the discussion here. Kind of how I sent this out in the email. So perspective of the city of Verona, both cities, city of Verona and the city of Fitchburg gave I think there were different amounts of hours to their police and fire 18 months ago. When the sunset was in there, they actually just gave all of their employees the remaining bank of what they had left into their sick time bank.
Oh.
The city of Fitchburg did what we did and sunset it. If you didn't have it, it just went away. I did reach out to Chad Brecklin, who did reach out to Mayor Richardson. At this point, there's no intent to bring this back. As I am proposing here. That was a week ago when I talked to Chad. However, since that week has occurred, I have also heard the city of Madison is proposing bringing this back for their employees. And I talked to Chief McMullen from Monona, and I don't know what happened to it, but Tuesday night, I know it went in front of the Monona City Council to bring this back for the city. I don't know if it passed or not. So giving you that perspective of there are other municipalities that are talking about doing this. Fitchburg is not one of them. So that does raise some stuff that I know will come up with 311 in Fitchburg. Your other option is to take this back to your municipalities and talk with them. If you don't want to sign this or don't want to approve it tonight, we can absolutely put it on the agenda for next month. And you can always make it retroactive. I guess discussions.
I think it's generous in a good way. I think that's just another positive thing for our staff, that we care about them and their lives and their family. We want them to stay. It's a good retention policy, or I'm not on any of those councils, but I think it's a good thing and would approve it.
Yeah, I agree. I think it does communicate that we do care about our employees, our staff. And, you know, to Sue's point, it is a retention issue. I mean, we're just hemorrhaging people left and right because people can go elsewhere. I'd rather keep the staff that we have by putting policies in place that show that we care. And this is an issue, especially for people who have littles who still can't get vaccinated. Childcare is a huge, huge issue. So I'm totally fine with moving forward with it.
I have one question as far as the test. Can they just go to Walgreens, CVS and pick up one of those home test kits and use that as a test? Or do you require them to go to a pharmacy and have it done by someone where it's documented?
We don't require it, we encourage it. So you know, it says in there, as long as you're seeking attention. What we've seen over the last, you know, it's only the 20th, and we've seen a number of cases of this already with our own staff, but everyone who has so far been asked to quarantine or been net exposure has gone and done a rapid test, and then went and got the PCR, whatever.
Yeah, it's a PCR.
PCR. So we don't require it. We do encourage it, and we have had one who the rapid said positive and the PCR, 2 PCR said negative. But it meets the criteria, right? They were asymptomatic, but it was an exposure, and kind of going back to, we don't want to take the risk of transmitting that in that really confined box we have.
Mm-hmm.
We can change it to require, you know, it's just so the length of time it's taking to get in to take tests
And get the results.
and it's taken 2 days to get them back. So, and working a 24 or 48, unless it truly falls, you're out at least 1 day awaiting test results.
No, I'm fine with the policy. I just wondering whether you.
We have not. It's been if you have symptoms and come back with a negative test, you're still covered because you had the symptoms, even if it's the Walgreens test. We did get, from our briefing with public health today, they have actually they did shut a couple of sites down in Dane County. So if you see any suspect sites, reach out to Dane County Public Health and they'll investigate them. Apparently there was one in Verona that was actually using not approved tests.
I went there.
Did you have positive or negative?
I had a negative test, but my wife and I, she's a doctor too. We were both looking at it going, this is just fishy. This isn't right. But we did it anyway. So
Q-tip and a piece of paper.
Yeah.
I think they shot one down on Mineral Point in Madison, the west side of Madison too. That was related and similar.
Any other discussion? I guess, Shannon, I guess you're the one I would ask, because I know this is going to have, this will have an effect in Fitchburg.
Well, you know, I'd like to talk to the mayor about it, but
Okay.
you know, I would like to talk to the mayor about it. I mean,
Okay.
I wouldn't be opposed to it, but I'd like to kind of talk to the mayor about it and
Okay.
see. I mean, does it affect our bottom line?
It will,
I
it
mean,
will, because essentially we're giving every employee 48 hours of sick time.
yeah,
they-
I would like to talk to the mayor and see what he says.
Okay. I did tell Chad that, I was bringing it to this group. So he is aware that this was being proposed tonight.
Okay.
Um,
Well, and then, maybe. Yeah, I would like to bring it to the mayor to see maybe if he wants to bring it into, discussion, because I have a feeling some of the other council people may want to know about it too.
so I guess that the proposes a little bit more discussion of you all of, it sounds like from what I'm hearing here, we can vote on it. The majority would pass it,
Okay.
unless you would like to give Shannon 2 weeks. We can always make it retroactive.
Well, next
give-
week, yeah, that would be nice. A
And
little
then I
bit
can,
of notice,
How
but
how
I
about
mean-
suggestion that if it's comfortable, how about we vote on it with a contingency that Shannon comes back and says it's okay, and then we wouldn't have to re-vote on it. And if she comes back and says that there's concern with Fitchburg
eh,
or not. Otherwise,
I
can you
don't
wait
think
a
it
month,
can
I
work
guess?
that way.
the other option is we can get the feedback and I can put together a special meeting. It would be all, I'll get another Thursday night at 7 o'clock. That would be all of 10 minutes for you to discuss it
mean-
again.
Okay,
Can it wait until next meeting, or would you want to, would you want to do another, like an emergency meeting? Do you think it's that important that you might have enough people out? Or,
So I have a question. What if he's not interested in it? We still have a vote and it's, is it not a majority, policy?
It is a majority. I'm just trying to play the politically sensitive
he
game.
was just asking if that was something you guys would be willing to do. If you're not willing to do it, I can just like abstain from my vote, and you
Yeah.
guys can pass the policy. If you feel that that's what you want to do, that's fine too.
Because I would prefer not to wait until the next meeting, I think just for the comfort level of staff and knowing that that security blanket is
Mhm.
there. I do
fine.
have people who are pretty low on their sick time for whatever reason it is, that if I told them to stay home for 2 days, they would be out of sick time.
Yeah.
So it can wait until the next meeting. If we don't get a majority at a special meeting, it could always wait for a meeting. Or what you said, we can vote on it tonight and Shannon can choose to abstain. And then it passes, it passes. I guess JR, you're the other representative from Fitchburg as well.
yeah,
I'm fine with it.
why don't we go ahead and vote on it then, and Shannon, you can abstain. The other thing, consideration, Wisconsin's leading the nation as far as having the most COVID cases per 100,000 people right now. So we're kind of at the tip of the iceberg, I guess, of this. So I think it's going to get worse before it gets better for us in Wisconsin.
Yeah, I don't think by next meeting, the peak will already have passed. I mean, the pandemic, it's really hitting right now. Cases have doubled each week in the last 2 weeks.
Yeah, it's exponentially.
And
I mean,
it's
I
my understanding there's members of the Fitchburg Fire Department that have had it recently or have it, so it is.
It's been through
Well,
both fire departments.
you want people to be able to stay home, otherwise the entire department's gonna get it,
Yeah. Yeah.
problem, so.
Well, why don't we go ahead and I'll entertain a motion to approve the policy as submitted.
Also
I
move.
would,
Okay, second.
second,
Okay, all in favor? Or why don't we do a roll call?
Yeah.
That way we'll have,
Second. Who was the first?
Roberts first, Luke and
Robert?
Buell's.
Okay.
Yes.
Okay. So, all right. So now I'll do the roll call vote. So Strassman.
I'm abstaining from
Okay.
saying anything yet.
Okay. Roberts,
Yes.
Onsdorf,
Yes,
Schnapps,
Yes,
Luganbuehl,
Yes,
Cronin,
Yes.
Johnson.
Yes.
So it passes even with the
Okay.
abstention. It is an MOU, so the union does have to agree to this. They may not. I don't know why they wouldn't, but they may not. So this will be another one, Terry. I will print out tomorrow and leave in the front lobby. I'll shoot you an email to
okay,
coordinate signing it, and then have to send it to the MOU, send it to the union for the employees to approve or not.
okay. Yeah, just send me a text message or email and I'll stop by and sign it.
Okay, sounds good. We'll take a pair of tongs and set it out there for you. So you don't have to.
I'll mask up and bring my own pen, so.
I will express. I know many employees have asked about bringing this back, so I will share with you. They're as you've said, they are grateful that you do support them and provide them with this benefit. It's some of them it will potentially make a difference on their pay, whether they continue to get paid while they have to stay home and deal with things. So thank you very much from them.
Hopefully they still stay healthy.
The goal at this point is at least to not have them all out at the same time.
Yeah, that would be a disaster, wouldn't it? Wow.
We had tomorrow's shift has 3 sick calls on it, either themselves or family members. So
Wow.
yeah. Again, I will do the shout out to, we have a phenomenal LTE pool that has helped out a lot. So you have a good district you're representing. So thank you for your support.
Any other business anybody wants to bring up? Otherwise, next meeting, February 17th, 7 p.m. I assume it'll be virtual again.
I would think so.
Yep. In fact, I hope we kind of continue this forever. It's kind of nice not having to drive in for the meeting, but maybe we'll get together once in a while. Support a motion to adjourn.
So move we adjourn.
Second.
Second, Lonsdorf.
Thank you. All in favor of adjourning? Say aye.
I,
Yep. Thank you. Guys, stay safe.
Happy New Year.
Yeah, Happy New Year.